going to record this. Okay. Hello, everyone. My name is Sheena Smith, and I am here with Connie Van Winkle to tell you guys about Medicare, more than you'll probably hope that you needed to know, but certainly a lot of changes this year. So she's here to make sure that we understand those changes. This is a recorded session. This is a makeup for the session that we had originally scheduled about 10 days ago. Please accept our apology for any inconvenience that technology problem that we had last time caused, and hopefully between this and the live event now and the recording that'll be available to you on YouTube. We are actually very pleased that this same class will be held again on November 17th. So if you want to register for that, that's another option as well. I am going to speak a little bit about NKA, New Knowledge Adventures here in the Treasure Valley. If you've been to any of our classes, you know that this program was actually created for lifelong learning, actually 15 years ago over on the east side of the state. And it came here to the Treasure Valley this is our 5th year, actually. So it is a partnership between the ISU and AARP. So if you've seen any of the posters around or any of that information, that's where the partnership comes from. We are going to, this is our first time, of course. It really is an adventure this time because of the impacts of COVID. So this whole session has been online. It's all recorded and it's out there on YouTube. And if you just search for NKA Idaho, then all of the classes will show up, including this one later on this evening. So I'm going to hand it over, and you guys, one way that we have everything set up, all of you should be muted. If you aren't, please do so. We want to get a good recording here and certainly be able to answer any of your questions by using the chat feature for Zoom. If you scroll down to the bottom of your Zoom box, scroll around down there, you'll see chat. If you click on that, you can send a question in, and I'll make sure that we get the question to our volunteer instructor. Want to make sure we say that, a volunteer instructor. And at different times during the session, we will stop and see if there's any other questions. So you may just want to keep a note of it, of the question, or because I imagine that she's going to cover most of your questions anyway. So we'll go ahead and get started now. I'll hand it over to you. Thank you so much for volunteering to do this for us, and we take it away.
Thank you, Sheena. My name is Colleen Van Winkle. I am a volunteer services coordinator with the Idaho Department of Insurance SHEBA program. And SHEBA stands for Senior Health Insurance Benefits Advisors. We are what's known as the SHIP, and I say that very carefully, program for Idaho. SHIP stands for State Health Insurance Assistance Programs, and there is one of those everywhere that there's Medicaid. So all 50 states and I believe 4 protectorates that are part of the Medicare program. So the District of Columbia, Guam, Puerto Rico, and the Virgin Islands, I believe, are where we're at. In Idaho, we are funded both by the state and by the federal government. Our federal funding comes through the Administration for Community Living. So this is we are now in the annual enrollment period, which is a time when folks who have either Medicare Advantage plans or prescription drug plans need to be checking those to make sure that any changes for next year will still make that plan the best plan for them. And it's also a point at which Medicare starts talking about what they're changing either right now or for 2021. And of course, one of the biggest things that's impacted us this year is obviously COVID. We're going to talk about what some of the changes have been related to COVID. In addition, we'll talk about telehealth services, and part of that is how COVID has impacted those. A huge change for next year is that Medicare Advantage plans must now accept Medicare beneficiaries who come into the plan with end-stage renal disease. We'll talk about a new program called the Senior Savings Program. We'll also talk about Medicare covering some acupuncture. And for folks who still are not collecting their Social Security benefits but are already on Medicare, there is a new way for them to be able to pay their Medicare Part B premiums. So I appreciate the opportunity to tell you about our program. As Sheena said, let's, feel free to chat in questions, and we will break every once in a while to see what's on people's minds. Okay, so right now, most of what's operating is under an emergency declaration because of the COVID outbreak. And under that declaration, there should be no out-of-pocket costs for testing for COVID when that testing is provided by a participating Medicare provider. That may be a doctor's office, an urgent care, a hospital, emergency room, but it must be provided with somebody who is registered as a Medicare provider for Medicare to cover that. In addition, most Medicare Advantage plans are also waiving costs for testing for COVID. Um, and probably the best way to get the most up-to-date information is to look on the Medicare website at medicare.gov. Or if you have specific questions and you're not finding an answer to them, you can always call Medicare at 1-800-Medicare, and that is 1-800-633 4227. I always have to stop and parse it out on the touch tone keypad. Okay, similarly, antibody testing, if you have original Medicare, they are not charging a copay for the antibody testing, and they will pay for some at-home testing. But I want to warn folks to be really careful because there are some fraud, scam type things going out where people are being contacted by telephone saying that this or that or another type of testing is available, and all you have to do is give your Medicare number. Don't give anybody your Medicare number. That is probably a way that they're planning on using that to bill Medicare for services you never receive. So, and with the Medicare Advantage plans, Medicare has told them they are allowed to waive costs. They have not required them to waive those costs. Most of the plans that are operating here in Idaho, we have learned from the director of the Department of Insurance, Dean Cameron, that the plans are being really great about making every possible attempt to make it as easy as possible for folks to get the testing and medical services they may need if they have COVID. Telehealth kind of rides along on that. Obviously, the last place most of us want to be with COVID hanging over our heads is somewhere where there are going to be sick people. So going to your doctor's office, getting assistance with that sort of thing has really moved towards telehealth. Uh, these changes started being implemented in early March of this year. in the past, there were some restrictions on how you could use telehealth with Medicare. Oftentimes they were geographical. Sometimes if you were being put in touch with, maybe you lived someplace like Chalice, and there was you needed to see a specialist. There obviously are not that many specialists available in Chalice, Idaho. One of the options you might have to see that specialist or consult with them would be to do a telehealth visit. And prior to March, what you had to do was go to your primary care provider site. They would hook you up to do the site, the telehealth visit with you, that specialist. After the beginning of COVID, they have gotten rid of those geographic restrictions as well as the site of service restrictions. They have also removed restrictions on the types of providers who can provide services through telehealth. And in some certain situations where being able to diagnose something does not depend on the doctor being able to see the rash you have, or other kinds of situations. They are even waiving the requirement for video. Beginning in 2021, Medicare Advantage plans um, are no longer able to deny coverage to people who come into their plan, or who would like to come into their plan, who already have end-stage renal disease. There were some very limited situations in which people could get in if they came in with end-stage renal disease. Obviously, if you developed it once you were enrolled in the plan, they couldn't kick you out because of it, but you also had very limited options for moving to different plans. As of the 2021 plan year, that goes away. Folks with end-stage renal disease should be treated just like everybody else. It is really important, though, if the person has end-stage renal disease and is using dialysis, to make sure that the dialysis center they're using is going to be in network with the Medicare Advantage plan that they select. We meet with the plans every year before the beginning of open enrollment, and we queried them especially on this situation, and we're told that they will all in network be charging 20% coinsurance. But if you're going to someplace that's out of network with an HMO plan, that would mean no coverage at all. With a PPO plan, that could be considerably more. We are seeing some services with PPO plans, not necessarily end-stage renal services, but other kinds of services showing up as having a 50% copayment. Sheena, are there any questions?
Not so far. Not so far.
Okay, so let's plow on then, shall
Okay.
we? Pardon me, I've been talking all day and my throat's getting a little scratchy. Okay, another development for 2021 is something called the Senior Savings Program. And this is a program that's going to have, we hope, really massive effects for folks who are on insulin. Under this program, certain enhanced Part D plans, as well as some Medicare Advantage plans with prescription drug coverage, are going to be offering plan choices that have broad access to multiple types of insulation. The participating plans have agreed that they will charge no more than a $35 copay for covered insulin products in all coverage categories. So during the deductible, after the deductible has been met, even during the gap, it will be $35. When you go into catastrophic, if that happens, you will pay the standard 5% copay. Now, 3 manufacturers are those who are participating, and those are Eli Lilly Company. That's the company that makes Humalog. Novo Nordisk has a couple of different corporate names, but their product is Novolog, and Sanofi Aventis is the company that makes Lantus, and those are the types of insulin. They should be covering both the vial and needle type of insulin as well as the insulin pens. I will point out that the generic drugs, there is now generic. I've did some playing with this week or so ago. There is a generic for Humalog and Novolog now. Um, it is not included in this $35 concept. And I have actually seen, looking at the plan finder, that in at least one case I tried, the generic actually cost more than the insulin did. So be really careful about how you're doing it. This also, you need to be aware that um, we haven't had enough experience with this yet to be able to identify if you take other medications, whether you're still ahead of the game to go with the senior savings plan, or how other medications in combination with the insulin in trying to find the most appropriate plan for you will work. The Medicare plan finder at medicare.gov does have a filter in place to be able to look. I think it's called, I think it's insulin program or something like that. It is not senior savings, but there is a filter if you want to go out there and play around and see what it might be. In terms of the online premium payment program, basically, if you are not having your Part B premium deducted from your Social Security, then it's always been a matter of you had to send in a check or you had to do something. Now you can actually go online to your My Medicare account and do single payments using a credit card or debit card, or by doing bill pay with bank savings or checking accounts to pay that Part B premium. Obviously, if it's already being deducted from your Social Security, Uncle Sam's making sure he's getting his money and you don't have to worry about it. Medicare is beginning to cover some acupuncture in an extremely limited circumstance, and that is for chronic low back pain. Apparently, this is designed to be an alternative to people getting opioids. There are very specific criteria that have to be met in order to qualify for it. The condition has to have lasted for at least 12 weeks. Your provider have been unable to identify a systemic cause for why you would be having this pain, and it cannot be pain associated with surgery or pregnancy. They will allow up to 12 acupuncture treatments over a 90-day period. And if it seems to be working and improvement is shown, they will authorize up to an additional 8 sessions. However, there will be no more than 20 sessions per year. And if at any point there's no improvement or the condition seems to be worsening, the coverage stops right then and there. Other things that are happening in terms of Part D, the prescription drug coverage, you may not be aware, but effective in January of this year, plans are no longer able to prohibit pharmacies from disclosing if there is a lower price than the prescription drug plan price for Medicare, for medicines to the beneficiaries. In the past, the plans did have the option of putting essentially a gag order on the pharmacies and telling them, I don't care if there is something cheaper out there, you can't tell them about it. That's no longer in effect. Beginning next year in January, any Part D explanations of benefits have to include information on drug price increases that they're planning to implement, and also information on lower cost therapeutic alternatives. So if you're taking a brand name drug and a cheaper generic comes on board, they will have to tell you that they're going to move to that or that it is an option for you. Oftentimes the plans move to generics and drop coverage for brand names. So those are pieces of information that are always important, and it's important to review those EOBs to make sure that you're familiar with what's happening with your plan. That my guess is we're going to see them utilizing this format rather than sending out letters under other headings about some of the changes they'll be making. Part D plans will be allowed to substitute generics onto their formularies more quickly during the year. Generally, they have to give you a certain amount reduced, or they may be allowed to just do it. We haven't gotten all of the details on that yet. I'd be really aware that generics aren't always significantly less expensive in the first year. As I understand it, what they do is they only license to one company during the first year that generics are available, and so that doesn't substantially reduce their costs. Everybody's always interested in what it's gonna cost them for the following year, so I like to provide that information. The Part D deductible this year was $335 was the maximum allowed by Medicare. Next year, it's going up to $445. Next year, the coverage gap will begin after you have spent $4,130 out of your own pocket. Oh, no, that's total drug cost, $4,130. Catastrophic is going to begin at $6,550 total out of pocket. And remember, when you're looking at total out of pocket, that can include any assistance you're getting from like the PAD Foundation or pharmaceutical assistance programs where they pay a portion of your co-payment, those kinds of things. So it's not out of only your pocket. If you have other resources to help pay those co-payments, those can be attributed to that where your catastrophic starts. With the Medicare Advantage plans, you're aware that there is a maximum out of pocket with those. This year, in-network was capped at $6,700. Next year, that's going up to $7,550 maximum. And for the combined or out of network, this year it was $10,000. Next year it will have a maximum of $11,300. That's not to say that all Medicare Advantage plans are setting their out-of-pocket maximums at these numbers. In fact, from the few I have looked at in doing counseling since the 15th of November, most of them have not gone to those higher levels. We're seeing probably in the $5,000 range for the average maximum out of pocket in network. Medicare tells us that the average premium for a Medicare Advantage plan in Idaho for 2021 is going down to $35.65. This year it was $42.62. That's not to say that any one plan premium will be that amount. And obviously, I always encourage folks not to make their choice of plans based solely on premium, but to look at what it's going to cost you for benefits and things like that as well. We do have 70, sorry. We do have 75 plans available in Idaho. And most all of those are available in the Treasure Valley. As you move away from the population centers around the state, there are fewer and fewer plans. Kootenai County is going to have more than Shoshone County or Bonner County. Twin Falls County is going to have more than Blaine County. And Bonneville and Bannock County are probably going to have more than other counties. In addition, we still have, I believe, 11 counties that will not have Medicare Advantage plans available to them. 12 of the Medicare Advantage plans are offering what they call innovative benefits, and that can include things such as wellness, the gym memberships that have been around for years and years, healthcare planning services, reduced cost sharing. Almost everybody is offering some type of hearing benefit. Many are offering vision and or dental as well. Some of those, especially for like comprehensive dental or a vision dental package may have an additional cost. That's what they call a rider. You can add to your coverage with a rider to pick up some of these at additional cost. And at least one plan is going to offer some a certain amount of rebate toward your Medicare Part B premium. Again, don't make your choice based on the dollars and cents of only premiums or rebates or things like that. Look at what your overall costs are likely to be. How often do you go to a doctor? How much is your copay for going to that doctor? Do you have to go to a specialist? How many times? How much is a copay for each of those? Are you looking at having some kind of special procedure, knee surgery, shoulder surgery, hip replacement, those sorts of things? They're going to involve hospital stays. They're going to involve physical therapy. So you want to be looking at what does each plan that you're considering charge, and then figure out based on that information what is likely to be the best plan for you. Now, obviously, none of us has a crystal ball that will tell us this is the perfect plan for you, because none of us know what's going to happen in the year. A year ago, if somebody had told us that there was going to be COVID-19 floating around the world, most of us would have probably gone, yeah, well, right. So, let's, you want to do what's best, but don't beat yourself up if you're off by a little bit. 5 plans being offered in Idaho are now going to offer hospice benefits. In the past, up until 2021, all hospice benefits reverted back to Medicare Part A. Even if you were on an Advantage plan, Medicare was paying your hospice benefits directly. So these 5 plans are going to be offering hospice benefits. We haven't gotten any details from the plans on how they're going to operate those benefits. But if you find that that's something that's important to you to know about for this year and have questions, I'd certainly encourage you to check with the plans. Okay, some important dates for folks to remember. October 15th is the beginning of the open enrollment or annual enrollment period for Medicare Advantage with prescription drug and prescription drug plans. That's the first day you can buy plans. You must make your decisions by December 7th in order for your coverage to start on January 1st of 2021. And a not terribly well-known option that you also have is if you have a Medicare Advantage plan on January 1st, 2021, then you have the option between that date and March 31st to make one change to your plan. So let's say you decide that your Medicare Advantage plan with prescription drug coverage just isn't doing how you wanted them to treat you. Don't get angry and call them and tell them what they can do with that plan. Instead, find talk to Sheba, talk to your agent, whatever, find the plan that you want to move to and enroll in that plan. That will automatically take you off the other plan. If you cancel the plan you're on, that's your one option for something to do, and you're stuck. You now have only original Medicare. You don't even have a drug plan. You can go back to original Medicare, and you could see if you could get a Medigap. Obviously, unless you're in the initial enrollment period for Medigaps or you have a guaranteed issue because you lost coverage through no fault of your own, you're subject to medical underwriting where they can look at your health and they could say they didn't want to cover you. If you do go back to original Medicare, you would be given the option of picking up a drug plan. Again, one choice, one chance. So the way to go from a Medicare Advantage plan to Medicare and a drug plan is enroll in the drug plan. That will kick you off the Medicare Advantage or Medicare Advantage plan with prescription drug coverage.
Say, Colleen, there is one question here.
Sure.
If you have a Medigap plan and you move, do you have a guaranteed issue with the new location? Can you?
Generally not. Medigaps are designed to move with you. You are not losing coverage through no fault of your own, since that Medigap is supposed to go with you. And so generally you don't have a guaranteed issue into another Medigap plan. If you move and decide you want to go to a Medicare Advantage plan, if you've gotten out of the service area of your standalone drug plan, then that could give you a special enrollment period to go to a Medicare Advantage plan. Anytime you go from a Medigap to a Medicare Advantage plan, be sure to contact the Medigap plan and let them know you're canceling your coverage. I would do that either by email or by finding an talking to them, finding an address and sending them a letter so you've got documentation. Because every year we run into folks who have been having Medicare, Medigap plan premiums deducted from their accounts. They go to a Medicare Advantage plan thinking that will automatically take them off the Medigap. It does not. And they go on for months and months paying a premium that can't be used for anything because you can't use a Medigap with a Medicare Advantage plan. And as a result, then they come to us going, this should have happened. It didn't happen. Either my agent told me it was going to happen and they didn't do it or whatever. Those companies are not obligated to refund your money. They sometimes will, but it's mostly a goodwill gesture on their part. There is absolutely no obligation for them to do so. So you could be out a lot of money if you go for a considerable period of time paying a premium for a plan you can't even use. So I think we covered everything on that slide. All right, so any more questions?
No more at this time.
I have a question.
Okay.
I continue to hear, and I've heard it from government officials, that the coverage gap was closed. And I find that the coverage gap is still present. Can you help me to understand that?
I'll do my best. Back when Medicare prescription drug coverage came out, Congress, in working towards creating this coverage, Congress looked at the numbers and they were exorbitant to offer offer coverage to people where they would only pay 25% of the cost, which was what they considered ideal. And initially it was kind of like, this is totally a no-go. Somebody apparently started doing some fiddling around with numbers, and they came up with information that showed that about 78% of the people who were on Medicare spent less than, and these are numbers from before I even started working with this program, so I'm just going to kind of create what I think are relatively reasonable numbers. They are not the exact numbers. So let's say they found that 78% of the people spent less than $2,000 a year for their medications. Then they found that another 18 or 19% of people spent between the 2,000 and let's say 3,000. And then there was a group of people who spent even more than $3,000, but it was a relatively small group, 8 or 9%. So they, being politicians, went, wow, 78% of the people, if we gave them a plan where they could get their prescriptions for premium and co-payments of less than what they're paying right now, at about 25% of what they're paying right now, they'd think we were wonderful. And then this other 18, 19% of folks, if they, if they had to pay full price between 2,000 and 3,000 or whatever, then essentially they're getting all of their meds for about 2/3 of the cost that they would normally have paid. And these poor folks who are over the other, clear up at the top, we'll just say that that's catastrophic. And after they hit that point, they only have to pay 5%. And think how happy everybody's going to be. So that's exactly how they set it up. Beginning with when the Affordable Care Act came in 2010, everybody got, if they hit the part where they fell into the donut hole or the coverage gap, which are synonymous terms, they got a $250 check. The next year, they started slowly reducing the percentage that the people paid when they fell into the coverage gap until 2020, where the plans set how much you're going to pay for a deductible, how much you're going to pay after the deductible, and then when you get to the point at which the gap started, that now reverts to everybody pays 25% in most cases. Obviously, if the senior savings deal, even in the gap, insulin's only going to be $35. But sometimes you have your costs go down when you go to the gap. Other times they go up. Most often they go up because your co-payments prior to that are less than 70 or 25%. And then there's still the 5% at the catastrophic level. Does that make more sense to you now, Mike?
Well, I understand that. I just know that the cost of the medications has exploded. I watched it double each year for several years. And
Right.
so the first 90-day supply of the medication my doctor wants me to take puts me in the coverage gap.
Okay.
That's pretty painful because
Yeah.
after that, it's hundreds of dollars every time.
Okay. And have you checked to see when you go to catastrophic, if that's the case?
I don't get to catastrophic.
You don't make it to catastrophic. Okay.
So
and are these
I
looking at?
remain in the donut hole. I just
Okay.
live in the donut hole all the time.
Yeah. And this is a broad-based scenario that they create to set this up. So individual experience may be very different than that broad-based, depending upon the medications that you're prescribed and things like that. But prior to 2006, you'd still be paying 100%. We have no way of really being able to identify what the costs of those drugs would be. But as long as Congress has a glitch on things that does not allow Medicare to bargain for the price of medications like the VA can, there's no real way of holding down those medication costs.
Thank you.
Sure.
So, Colleen, I have one other question here.
Sure.
Just let me, I'm a little confused on the Medigap thing, so I want to make sure. So if I have Medigap here in Idaho and I move to Arizona, I can keep that same Medigap plan when I move. No problem at all.
So long as so long as the same company is selling that plan or servicing that plan in Arizona.
I understand. Okay. I got you. Okay. And then the one other question that I have is, I turn 65 next year in 2021.
Okay.
So am I eligible for open enrollment starting
No.
now, or do I have to wait until my
No.
birthday?
Okay, so let's do a little quick review of enrollment periods. All right.
Okay, great.
Your first contact with Medicare is your initial enrollment period. And that centers around when you become eligible for Medicare. There are a couple, basically 3 scenarios. One is you're turning 65 other than the first day of the month. Another is you're turning 65 on the first day of the month. And the third one is you're becoming eligible for Medicare due to disability. Okay, so in each of those scenarios, you have, well, let's start with the one where you're turning 65 on the first day of the month. Somebody a while back, maybe at the beginning of Medicare, came up with the brilliant idea that you actually turn 65 the day before your birthday. And there is a part of Medicare rules that says if you're eligible for Medicare one day in a month, you're eligible for the entire month. So applying that theory, if your birthday's on the first of the month, you became eligible either on the 28th, 30th, or 31st of the previous month, depending on which month is the previous month. And that means that if you're eligible for, let's say you became eligible the 28th or 29th of February, then you're eligible for all of February. Okay, so depending on when you become eligible for Medicare, your initial enrollment period starts 3 months before the month in which you become eligible. It includes that month of eligibility, and it goes 3 months after. If you enroll in Medicare, don't think about any of the other plan options, but if you enroll in Medicare, in the first 3 months, your coverage begins the first of the month of eligibility. If you wait till the month of eligibility, your coverage begins the first of the following month. If you enroll during any of those 3 months after your month of eligibility, then your coverage gets put off further and further. So if let's say my birthday's in September, if I had enrolled in September, it would have started in October. But if I'd waited till October, it wouldn't have started till December. If I waited till November, it wouldn't start until January. And if I waited till December, it wouldn't start till February. Okay. If you don't get enrolled during one of those 7 months and you don't have other creditable coverage that you can defer it based on, then in the 8th month, you decide, oh, darn, I meant to enroll in Medicare. You can't. You now have to wait until January 1st, and you can enroll for the general enrollment period. You can enroll from January 1st to March 31st, but your coverage isn't starting until July 1st. So they really smack you with a heavy hammer when you do that. So then the annual enrollment period is for folks who are already enrolled in plans or who have decided that they want to get enrolled in either a Medigap. Medicaps are a separate situation, either in a prescription drug plan, a Medicare Advantage plan, or a Medicare Advantage plan that includes a prescription drug plan. None of the Medicare Advantage plans here in Idaho that are offered are you allowed to have one plan that covers your health care and a separate plan that covers your drugs. If you want healthcare and drugs and a Medicare and have that in the form of a Medicare Advantage plan, you must get those in the same plan. So those are called Medicare Advantage plans with prescription drug coverage, or what we call MAPDs. Okay, and then you have what are called special enrollment periods, and those are things that happen under any of a number of situations. You've moved out of the service area of your plan, you have you lose coverage for no fault of your own, you were working, so you deferred something like your Part B coverage, and then when you leave employment, you need to get hooked, get your Medicare set up and moving forward. That's also gives you a special enrollment period. And since you can't get into Medigaps or Medicare Advantage plans without both A and B coverage, then that special enrollment period also gives you an opportunity to enroll in those plans. And now everybody's eyes are whirling and their heads are twisting and they're totally confused, right?
No, I think I got
Good.
part of that. Oh, thank you.
You're welcome. My goodness, this is a shy group. Usually people don't want to talk in front of other people, but I usually spend almost as much time doing answering questions as doing presentations when I speak to this group.
Yeah, guys, if you have any other questions, you can jump right in now.
Well, I'd like to say thank you very much. I appreciate this. Thank you
Well,
for
thank
doing
you.
it.
You're very welcome. It's always a pleasure to come in and help people learn more about Medicare. It's one of the things that I love about my job is that I've always been somebody who liked to help people learn things. And so I appreciate the opportunity that AARP and New Knowledge Adventures has always provided for us to do this presentation. And I always enjoy working with the folks to help them have a better understanding of things.
Yeah, it is. It is. It's not a walk in the park. So we're lucky to have folks like you to help us out. So one other question is, let me see, is basic premium costs for B and D going up next year?
The Part D, the average cost for D is going, I believe, down. And yes, we believe that the Part B premium is going up. We have not seen official numbers on what it will be. We do know that there was a budget act enacted within the past 2 months or so that said that the Congress was going to underwrite some of the increase so that it wouldn't be paralyzing for folks. Also, if you're already receiving Social Security benefits, there is a piece of legislation, or actually a law now, that says that your Part B premium cannot rise any faster than your Social Security earnings go up. And we know that folks are going to get a 1.3% Social Security increase. So your premiums will be going up in most cases, but we haven't gotten real clear information on what that will be. That usually comes out pretty late in the year, unfortunately. I don't know why it takes so long for them to get it out, other than they do have to look. It's supposed to cover 25% of the cost of operating the Part B program. And so they have to kind of get a handle on how much that's going to be each year to determine what the premium's going to be. We have not seen any indication that the IRMA for folks who earn higher incomes will be rising again this year. They did an adjustment on that last year, and they usually don't do adjustments terribly often on IRMA. So that's probably going to stay pretty much the same.
Can I ask you a question on the IRMA while you're there?
Yes, you can ask. I'll do my best to answer it.
Well, I got one of those nice letters that said I will have an IRMA charge, and it was quite substantial because 2 years ago. I'm just starting enrolling. So 2 years ago, I had a
Brian,
one-time high income.
Can you hear it okay? I
no,
can't hear.
Brian, you're fading in and out. I'm not quite sure what the reason is.
It's probably my microphone here.
Okay.
Oh, that's really
Now
good.
it's
That's
real
good
good.
now.
Now it's good. Okay, good.
Yeah.
Anyway, I sent off the form. It's like an SA 44 or something like that. And I
Okay.
just sent that in to Social Security, the local offices here. But I'm wondering how I know whether that exclusion has been accepted or not for me.
They'll let you know.
Oh,
It may take a little while if they have overcharged you, by the time that they do arrange the decision, then probably within 90 days, they would send you a refund. Remember that if you have one unordinary year, then you can submit that request for reconsideration, or they can say, no, we're not going to change it. However, then the next year, if your income has come back down to a lower level, you may see the IRMA lifted at that point.
well, that's actually what I sent the form in because it
Okay.
came way down. I've already got my 2019 taxes done, and it showed that it came way down from there.
Okay.
But I guess I'll just have to wait and see. Do they normally send a letter out for that then?
You're dealing with Social Security in those situations, and we don't have nearly as much information about Social Security as we do Medicare.
I understand.
So I'm sure you will get some, yes, we approved it, or no, we didn't approve it, and pay up. Or you'll just see it come out of your check.
Right. I suppose I could try and call in again and see if there's any
Yeah.
status updates.
Yeah.
But, okay.
All
Thank you.
right. Sorry I didn't have a clear answer for you.
Like you said, I don't think anybody does.
Okay.
Okay. Any other questions, you guys? You'll think of something when you get in the shower tomorrow. You may as well.
Okay, let me, if I may, I would like to put a plug in for our program, the Sheba program. We can help folks. We are not doing face-to-face appointments this year, but we are doing phone appointments, and some of us are setting up appointments through WebEx to do counseling. Some of our volunteers have expressed an interest in using Zoom to do their counseling. You can reach us at 1-800-247-4422. Or if you'd like to email me, I'll be happy to try and answer your questions. You can reach me at Colleen, COLLEEN Van Winkle, VANWINKLE at DOI for Department of Insurance .Idaho, and you have to spell Idaho out, .gov. And if you want to email me, I'll be happy to try and answer questions. If you need an appointment, please call the helpline at 1-800-247-4422.
No other questions?
I have one more.
Okay, Brian.
Excuse me. I'm the one that asked the question about the guaranteed.
You got to get back closer to that microphone.
Okay, I'm the one that asked the question
Yeah,
about the
I can see
guaranteed
your
issue.
name on the screen.
Okay. Anyway, I'm still a little bit confused. So let's say I get Blue Cross of Idaho, and then I move to, you mentioned Arizona. Well, I have no idea whether Blue Cross of Idaho sells down there or not, but if they don't, then what you're saying is that I wouldn't get a guaranteed issue. I would have to
No,
reapply.
if you couldn't carry the plan with you, you would qualify for a guaranteed issue.
Oh, okay.
But
All right.
if you go someplace and that plan could go with you, then you're no longer losing the plan through no fault of your own. And that's really the nexus of whether or not a person is eligible for a guaranteed issue situation.
Right. So you just stay on the same plan if it's available there. If not,
Correct.
then you would get a guaranteed issue.
You should, yeah. Now, remember
Okay.
that the plans, the Medigap plans, are regulated by the individual states. So the rules in Arizona or any other state may be different than they are here in Idaho. For example, here in Idaho, they can only raise the premium once a year. I have seen information for about Medigap plans that indicate that some states may allow them to have multiple increases in premiums. Also, Massachusetts, Minnesota, and Wisconsin have non-standardized plans. Their plans were grandfathered in when all the other plans were standardized. So if you're thinking about moving there, check with them first.
Thank you very much.
Sure, you're welcome.
Okay, one more then. If
Great.
nobody else is going to do it.
Nope, perfect.
This is great. Thanks, Brian.
This one has to do with rates. As you mentioned, Idaho only allows one rate a year. So let's say on a Medigap plan, if you watch a bunch of YouTube videos, you'll find that they kind of talk about how the plan Gs are more expensive than the Ns, and it has a lot to do with the guaranteed issue. But where I'm going with that is that they say those will tend to go up more now that there's a smaller guarantee, or that the guaranteed issue plan, since plan F closed, is going to go to G. So that may increase the rates. But it sounds like Idaho only allows cost of living increases, so that may not affect that. Is that your understanding?
Well, there's a couple of things at play here. We changed the rule in 2018 on a couple of things. First of all, prior to that, plans that wanted to sell in Idaho did not have to offer coverage to people who are under the age of 65. That changed then, and some of the folks who didn't want to play took their marbles and went home, and then came back the next year with new plans. But the other thing that we changed with our rules was that the companies, if they're going to change their rates, their rate changes must be applied equally across all plans that they're offering. So with F no longer being marketed to people who became eligible for Medicare on or after the first of the year this year, that does not mean it's going away. Anybody who has that plan is still being serviced in that plan, and that the rates for the F, the G, anything else are going to go up the same amount across. Essentially what they're doing is floating all boats on the same tide. So if they're raising the premium on an A 8%, they would be doing the same premium increase on any of their other plans that they offer.
Perfect. That's exactly the information I needed. Thank you.
You're very welcome.
I think that's all I have.
Okay. And by the way, Brian was not a plant. He was just somebody who really wants to learn, and I'm glad that he asked those questions. I'm sure some of the rest of you might have had something along the same line, but maybe didn't want to ask.
All right. Any other questions? Wealth of knowledge here for us if we need it. Okay, and Colleen gave you a couple other ways to get in touch with her if need be. So I think we have either fried their brains or exhausted all the questions at the moment. Like I said, when you get in the shower tomorrow, you'll come up with another question, I guess.
That's where I do my best thinking.
That's right. Okay. Well, if no other questions, we'll go ahead. Thank you so much, Colleen, for doing this for us.
You're very welcome.
And we just appreciate it and recognize as a volunteer for us. This is it's important that we get this information at this time. So appreciate your being willing to do it 3 times for us now. So 3 times
Absolutely.
here, and we appreciate it
Great.
all.
Thank you so much for having me.
Okay. Thank you. Bye, everybody. We'll see you either on YouTube or on the 17th.
Thanks a lot.
Thank you.
Bye-bye.
Bye-bye.